I'm one of those people who has always wanted to be a doctor in a way. I wanted to be a doctor from a really young age. My father was diagnosed with colon cancer a few years before I entered even into college. Seeing the experience that he had, unfamiliarity, not having had health problems in the past, just wanting to be able to not only support him and answer the questions that he had about his health, but also be able to be there for my family and be able to answer any questions that they have and kind of work, with them through a pretty difficult time and be able to help them in a way too. I chose to go into family medicine. From the beginning of medical school, I really thought preventative care was going to be an important issue in the future. One of the tools that I have for encouraging my patients to come in for their preventative care, I think, is just establishing a trusting relationship. So the first visit they come in to see me is probably not for a preventative visit. They probably come in because they have some kind of acute issue or some kind of chronic medical condition that they want me to take care of. And hopefully just being able to address that issue with them, that's very important to them seeing that I am listening to them, that hopefully I'm able to communicate the goals clearly to them for them to be able to manage their chronic conditions well. And then after that, maybe more of a, hey, before you go, why don't we schedule you for an annual visit to take care of some of these other issues that we can prevent before they happen. In my last year of residency, I had a long-standing patient who I had been trying to convince to get a mammogram for several years, and I convinced her to finally get one in my last year. So it took that trusting relationship of seeing her over several years, but I finally convinced her to go and get a mammogram, and unfortunately on the mammogram they did find an area of breast cancer, but thankfully it was caught really early, and she started treatment with her oncologist, and I followed her till the end of my last year of residency, and she was doing really well, and it was just really lucky that we caught the breast cancer really early, and breast cancer is one of those diseases now that is very treatable and curable if we catch it early enough, so I was very happy about that. I'm Faryal Turtle. I'm a family medicine physician practicing at Intermountain Taylorsville Clinic.